Good morning, everyone. Welcome to the Maryland Alcohol Licensing Association virtual meeting. My name is Kathy Durbin. I am the Director of Alcohol Beverage Services in Montgomery County and the outgoing president of MALA. Our business and our personal world has been rocked this year due to COVID-19. Despite the pandemic, we carried on. I'm very proud to be part of MALA, which includes regulators, administrators, inspectors, trainers, and board members from all around the state. We should all be proud of the flexibility and tenacity exhibited by this group during the pandemic. We have proven that government can be innovative and still increase public health while keeping communities safe. Obviously, we would much rather be meeting in person in Ocean City, or perhaps another location around the state, but that wasn't in the cards this year. We do have a tentative hold at the Grand Hotel Mother's Day weekend 2022. So we will use the technology that has become a major part of our daily lives to bring the MALA meeting to you. Technology has allowed us to continue to connect during these many months, and I believe it will continue to play a major role as we move forward and interact with license holders and with each other. How exciting it will be to see what the new normal brings us. Remember to keep your minds and hearts open. Today, we are using the Zoom platform. Thank you to Barb Cooper and Roddy Adgiri for working behind the scenes. To open our meeting, I'm pleased to present Lila Cooper, daughter of Barb Cooper, who will sing the national anthem.
Hello. Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rocket's red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the brave? Thank you.
That was beautiful. Thank you, Lila. Really appreciate that. What a great way to start the day. So let's see who's next here. So we're going to start with, I think we have, the MALA Executive Board report. Sorry, Debbie. So for Debbie Osteen from Garrett County and Earl Bradford from Cecil County. Thank you, guys.
Good morning.
Thank you, Kathy.
Morning.
Our first order of business would be to conduct the 2021 MALA election. As you can see on the screen, we have a full slate of officers and executive board members. We did have a preliminary vote on SurveyMonkey. At this time, I'll open up the floor for any nominations. If nominations are received, we will do an additional vote by SurveyMonkey in the near future. If no additional write-in or nominations from the floor are made, I would present this slate of officers to the president as the new incumbents for the 2021 election? Hearing none, I would make this the official slate and present this to the president of the association, Kathy Durbin, for approval.
So approved.
Thank you, everybody, for going online to vote and being a part of our team.
Thank you. I'll turn it back over to you, Kathy.
Okay, thank you. Well done. Especially you put everybody on mute, right? So they couldn't speak. Is that what you did?
That's correct.
Just kidding. So I want to remind all the folks that are listening that the bios will be made available of everyone speaking today. We have a great group bringing you wonderful information today. So Rami, if you're ready, we are terribly early, but I'd like to introduce Rami. Rami Eck has over 20 years of clinical and public health training and experience. She authored the Maryland Comparative Analysis of Alcohol Regulatory Systems a couple years ago. We do have that document. We use it. I used it a lot this year in Mala. It was awesome during the legislative session. So we want to make sure everybody has a copy of this. She worked through personal interviews and data collection. She's updating key elements of the original document this year, creating an important and relevant snapshot in time as it relates to COVID-19 and the impact on regulators and businesses in Maryland. Rami?
Thank you, Kathy, and thank you to the MALA board. I really appreciate you all inviting me to be here. It's wonderful to see a lot of people that I know in the audience and others that I really hope to get to know better over the course of time, either with this project or somehow in another way related to alcohol. So I am with the Maryland Public Health Association, and we are an organization with a mission of healthy Marylanders living in healthy communities. And our vision is to improve public health in Maryland through education and advocacy. So fairly straightforward, and we do this through meetings, educational events, webinars, trainings. We meet with legislators, both at the state level, the local level, all the way up to our congressional representation. And we partner with a lot of other organizations across the state that expands our expertise in health and public health. So I kind of want to couch this conversation in a public health framework. I always like to start with this a little bit so that we're all on the same page about what public health actually is. And so looking back in the 20th century, the 10 great public health achievements helped lead to 25 of the 30 years of increase in life expectancy was gained by public health interventions. And these interventions include vaccinations, motor vehicle safety, safer workplaces, family planning, safer and healthier foods, recognition of tobacco use as a health hazard. So these types of things that are not individual medical interventions is what led to the bulk of the increase of our life expectancy over the past 100 years and even beyond. So it's nice to be able to look at that and say that's why public health is important. So here's another pyramid. If you've ever seen me talk before, you've probably seen this pyramid before. This is based on something that the CDC has put out. And it sort of shows you a stepwise approach to health, to improving health, and how we don't look at just an individual as an individual itself, but we look at things on many levels. So looking at the top of the pyramid, the smallest impact is counseling and education, things like eating healthy, being physically active, things that we can do on our own. And as we move through to the largest base of this pyramid, all the way up to the socioeconomic factors, such as poverty, education, housing, inequality, we know these are really the big drivers for ill health. But it's these places in between where we actually really intervene most of the time. And public health likes to intervene where you see this red circle and changing the context. So to make individuals' default decisions healthy. You walk out the door, you go into your neighborhood, you go anywhere that you go, just living your life, your default decisions are going to be made healthier. So things like fluoride in the water, 0 grams trans fats, smoke-free laws, tobacco taxes. And if we apply these levels to alcohol, when we go to this changing the context band, we look at things like removing dangerous products. So remember alcoholic energy drinks, increasing excise taxes on alcohol, reducing alcohol outlets. These are big things that we can do for community change at a larger level. And you can see some of those other things, the counseling education, the clinical interventions. These are all important. These have to work along with each other, but public health will usually like to sit in this much larger band. And then you'll also see on the left, it says little political will needed at the top, all the way to much political will needed down towards the bottom. And the last thing I want to just say about public health is you've probably seen or heard on the news or the radio or the TV, social determinants of health. It's something that I know has become a lot more popular in just plain language in the media. And what this is it's looking at an individual and all of the things that influence your health. So it's not just you, it's not just your healthy eating or your non-healthy eating or activity, but also your neighborhood and your built environment. Where do you live? What's around you? What are you being exposed to? What are you moving and walking and transporting yourself through? The quality of your healthcare, your education opportunities, economic stability, all of these things really contribute to the health and the benefits to an individual. So you're not by yourself, you're surrounded by all these types of things that lead to better health. So pillars of alcohol regulation, we can all agree on this, is that alcohol is not an ordinary commodity. It's why we regulate it differently than we do other types of products. There's a role, the important role of science in informing and enforcing alcohol regulations, and then also finding a balance between public safety and commercial interests. This is where public health also lies with alcohol regulation. And why do we care about this? Well, because the cost of alcohol use are very expensive. So 200 ICD-10 codes are attributable or associated with alcohol. Almost $250 billion in the entire US is the cost of excessive drinking, according to the CDC. It's the fourth leading actual cause of death. And then 1 in 10 deaths among working age adults are caused by excessive drinking. And I'll note that CDC uses this term excessive. So anything that's actually just below that, so things like cancer increase in risk of cancer begins with the first drink. That's not even included in these types of costs. This is just excessive drinking. So pregnant, underage drinking, binge drinking. If we look at just Maryland, we see $5 billion was the estimate from the CDC back in 2010. It was about $2.22 a drink. And we can break that down into even further. So what contributes to this? So alcohol attributable violent crimes, just these 4 types of violent crimes: rape, robbery, aggravated assault, and homicide, $655 million or $109 per resident in the state of Maryland in 2015 is what was calculated. So shifting away from this public health frame, why we regulate. And so what do we know about the impact of alcohol during the pandemic? So again, just something to get us on the same page here. So we do have research from previous pandemics, SARS and swine flu, that says things like stress, boredom, isolation, these can be triggers for alcohol use. Things that sort of make sense, but we actually have done studies to show that it is absolutely the case. We had more leisure time. There's fewer alternative activities. This could lead to increased use also. Alcohol weakens your immune system, could lead to poor outcomes with actually contracting COVID-19. Alcohol sales were 10 to 20% higher in March and April of 2020 compared to 2019. We're still waiting to see if this upward trend in that is going to continue or if this is something that was a blip. Relaxation of regulations and also of enforcement. So these are things not just in Maryland, this is things that we saw nationwide. Specifically in Maryland, however, we saw drinking alcohol when working from home. One survey saw that 40% of Maryland workers reported they were drinking alcohol at home during the work hours. And then also just research, and again, this is very much an evolving field because we're still in real time here. So this is earlier on in the pandemic, is that 1/3 of adults were drinking more now than they were before the pandemic. The average number of drinks per day and binge drinking rose about 26% between February and April of last year. And the largest rise was in households with kids. So parents who feel stressed about distance learning drank 7 more drinks a month than those who did not feel stressed. And those parents were also twice as likely to report binge drinking. So this data is really showing us that, higher stress situations, people may be turning to alcohol and they may be using it more in 1 or 2 settings as opposed to stretching it out over time. We also saw a very concerning 41% increase in heavy drinking among women. What kind of effects might we see? So shorter term effects related to impact on youth at home through domestic violence and child maltreatment, impact of alcohol on the immune system in responding to COVID-19, an additional risk factor for depression and suicide. So longer term effects we could see for those who are drinking moderately, this could lead to an escalation to abuse or dependence. Longer term health effects from increasing consumption. If this increase in the consumption that we saw over the past year, if this continues into the future, that has implications for chronic disease. And then also a possibility of a modeling of unhealthy drinking behaviors. If mommy and daddy are drinking in the middle of the day when they're supposed to be working, kids are at home where they've been doing school, and they see this, they may see this as something that's normalized. So again, switching gears to the actual comparative analysis, implications for use. So I spoke to many of you or many of your colleagues over the past 2 to 3 years. What did we do with that? We really took that information with us forward to inform a lot of the work that we do. I know that report was shared widely with policymakers. Many of you may have used that in your own work and programming in your jurisdictions. So how did we actually use this? Just sort of looking at a case report. In the 2021 General Assembly, there were 2 main bills that we really worked on. One of them was the Cocktails to Go or delivery, and the other one was the Healthy Food Accountability Act of 2021. That bill was ultimately pulled, so the one we're really going to talk about is the first one, the Cocktails to Go. So the message that we gave was from the lessons that we learned in speaking to you out in the jurisdictions. And so there are things that are often missing from the legislative conversation. And one of these, a big one of these, is considerations for additional burden on administration and enforcement. So your ability really to do your job and do your job well. The impact of increasing alcohol outlet density. So restaurants turning into de facto liquor stores was a concern. And this was something that was promoted at the beginning as possibly being an issue. Implications for product innovations. And then also, especially very importantly, input from local licensing boards and enforcement officers. Were you contributing to this conversation when decisions were being made about things that were going to happen in your jurisdiction? And over here you can see on the right, the Alcohol and Tobacco Network is something that MDPHA has put together over the last 3 years. And this year it really came together. Some of our partners are included here, coalitions, universities, advocacy organizations. We have a lot of individuals, also researchers, community organizers, and things like that, that all really were speaking with the same voice in terms of the public health, the safety implications, and recommendations on this type of bill. So we also were able to bring data to the table, and thanks to a University of Maryland law student, she called all the jurisdictions in Maryland and ended up being able to speak to 16 of you. And 13 reported that no compliance checks had been done, and many reported being underfunded and understaffed to monitor new carryout and delivery licenses. Again, something that came through loud and clear when we did the report, the first comparative analysis report. There was also concerns about COVID exposure, of course, and then just some overall concerns when she asked about the increasing number of licenses to monitor, inability to charge a fee, open container and drunk driving violations, lack of local liquor board autonomy and cross-border enforcement, all things that came out in this conversations that she had. And thank you to those that she was able to speak with who shared these things. And then we do know one of the 3 jurisdictions was Montgomery County, did a mystery shops program, and they did find that 55% of businesses didn't check IDs, and only 15% stated that IDs would be checked at pickup. So we do have some hard data on that, and it showed that it just really wasn't being enforced like we would hope. So the final bill, and I won't go through this because most of you probably already know this, but it does give jurisdictions the ability to decide whether they want to go forward with this or not, rather than using that really keyword required. That's something that I know that is a point of contention sometimes. Gives some parameters for how it can be sold, when it can be sold, where it can be sold, who is actually doing the selling and the delivery, and where it can be going, where it can go. The other thing that it will also include is a study. So we have data on so many things, so many policy interventions and outcomes and program interventions for alcohol use and reduction of harm. But for this is something that really was completely new. And so we had some things that can contribute to the conversation. We could think about what might this lead to, what potentially could happen based on other situations and other research. However, They did include a study that will be on the expansion of alcohol access, including the impact of public health, and that'll be done over the course of the next 2 years, and also retrospectively for the executive order from the governor. And then a report will go to the General Assembly right before they start the session, right before this legislation actually sunsets. So they'll have more at their fingertips to be able to make a decision about whether, we make this permanent or not. Do we need to change anything? What are the implications for this? And what are the implications to other types of legislation that may come down the line that this type of data could actually contribute to? So as you heard, there's going to be an update to this project. Your input from the first one is just so invaluable, and be able to get your voice to the table, the things that you actually need to do the work that you do so well. And so some of these updates are going to include some identification and confirmation of the public health and safety priorities in the state and in jurisdictions. Are they the same? Are they different? Everyone has individual needs. And have those changed since we asked you the first time 2 or 3 years back? Recognition, successes, model processes are the things that we want to be highlighting, are the things that we want to be sharing with other jurisdictions, even with other states. We're not isolated here. There are other states, especially with the cocktails to go and some of the recommendations that we made. We were able to share that with other states, and they were able to suggest that to their legislators also. How has the pandemic affected your operations? We know it has. We know some of the ways that it has, but we want to really get a record of how did this affect you, and what are things that we can do to help you put in place so that the next time, I'm saying next time a pandemic comes around, but just any time we are moving forward and something happens, we're prepared for it, or that we can just anticipate some of the needs that we might have. And then also needs for improving operations pre and post pandemic. What were things that were already issues and needs that you had before this even happened? And what are things that evolved over the past year, or you became more acutely aware of? Things that weren't maybe priorities before, but now are priorities, and how does that look going into the future? How are you prioritizing these types of things? And so all of this really has implications for improved communication, policy interventions, resource allocation, advocacy opportunities, and education in alcohol enforcement and regulation across our state. So I really want to thank you for listening to me for the last few minutes. And if you have questions, I would love to talk to you about those things now.
Sorry, I'm trying to unmute and on video and on everything. So thank you, Rami. That was a great presentation. I'm looking in the chat and I don't see any questions, but I will say that this comparative analysis was so important to me this year, to go back and look at some of the information that was given. And it's a couple of years old, but it was okay to look at the the various boards, to, even if it was quantitative, some of the numbers I needed, because elected official would ask me questions about what the other liquor boards were doing, and to understand, do they feel the same way? So it was really good information to have, to say, this is what their budgets are, this is what they do, here's the report, look at it, and allow the elected officials to also understand the various jurisdictions, because we definitely are not all alike. And our communities are different. So thank you for that. It looks like somebody asked if, oh, you already have it. You're quick. So you're going to share it. So this is great. And so I think that for this group to understand that they will be contacted, and so we can update any information. And I think we're going to find some really great tidbits as a result of the pandemic as well, of what people did to make it work, because we didn't stop working. We continued to work through the pandemic. And so that's all very important. So thank you very much for that. It looks like, since we're running so early, we're going to take a 15-minute break. We're going to come back online at 10:45. So if any of you all need to stretch or get up, walk around, do whatever you need to do, please make sure you're back here by 10:45. Thank you. Thanks, Roddy. We're back. Okay. Okay. Thanks. Thanks for leading us in, and it's 10:45, so we're going to get started. Rami, did you want to add something to your conversation from earlier? Are you there, Rami? Oh, there you are.
Sorry, you were very accurate with your timing. So I am here. Yeah, so I just wanted to kind of wrap up the presentation by letting people know what's coming next. So the initial comparative analysis was, there were surveys, a couple surveys, there was also in-person interviews, there was a lot of data collection behind the scenes. So we're not redoing all of that because not that much has changed. What we want to do is add to it and extend it based on what we've learned. So I want you to be on the lookout for an email from us that'll just, kind of give you some parameters of what we're looking for, and then help set up a time that we can actually speak and go through some of the questions that we have set up. It won't be a huge amount of time out of your day. And then if you just want to be thinking ahead, if there's anything you'd like to discuss, add to it, things that have been on your mind, we'll keep it pretty narrow focus to what we're doing, but you can always add things like that. There could be some issues that come up that we're just not aware of, and other jurisdictions are dealing with it too. So just be aware of that. Think about who might be the person would be the best to talk to, or if there's someone else that you'd like to suggest that we speak with. And so again, just be on the lookout for that.
Perfect.
Thank you.
Can't wait for that information. Thank you. Okay, so let's move on here. So again, welcome back, everyone. And I'd like to introduce Jeff Kelly. He's a longtime member of the AMALA board, the executive board, and he's also a very good friend. And we love seeing Jeff as part of our all of our meetings. He is the director of the Field Enforcement Division for the Comptroller of Maryland, and also the immediate past president of the National Conference of State Liquor Administrators. Until January 1, 2021, the Field Enforcement Division was Maryland's regulator and enforcement agency for the state's alcohol, tobacco, and motor fuel industries. Today, we will learn more about the State Alcohol Tobacco Commission. But first, Jeff will give us an update on alcohol legislation that moved forward this year. Jeff?
Good morning, everybody. Thank you, Kathy, very much for that. I appreciate it. It's good to see everybody. It's been over a year and a couple of months since we've had to be in the office routinely every day. Hence this. I don't want to hear any comments. It's what happens when I go unsupervised for a year. But just for the record, it's probably the wildest thing I've ever done in my life. So it's otherwise been a pretty boring period of time, I guess. And I have to just make this comment. You guys have been terrific this year. It was a very difficult year. A lot of weird stuff happened. The governor's executive orders threw a lot of what we always knew to be the right way to handle things into turmoil. But I think one of the other things it really did was it demonstrated your ability to be flexible, to think through problems. It kind of demonstrated why our local jurisdictions are important regulators in alcohol, as opposed to it being a one-size-fits-all statewide approach. You guys learned what was going on in your communities, what you needed to do to protect public health, to ensure or promote temperance, and also make sure that there was an industry at the end to still regulate, to let these businesses stay in business. And you did a great job. And I'm really proud of you. And I tell people, I describe it that we were always kind of used to saying no when we were asked to be able to do something or asked to let someone else do it. And what we've really ended up doing is learning how to say yes, and conditionally yes in some instances. So way to go. I'm really proud of you guys. If you'll endure me for a few minutes, I have approximately 15 minutes to go over some legislation. I'm going to be kind of fast. I tend to speak quickly anyway. I'll slow down a little bit on some of the bigger bills and a couple of them that are statewide that certainly have implications for you guys. So I will slow down for those. When it gets into the local bills, I'm going to try to at least mention all of them that have passed and what the brief sentence or two significance is for your jurisdiction. So I'll let you know what jurisdiction I'm in and what the bill number is, and then basically what it does. If anybody has any questions after, I'm happy to take them. But what I intend to do is after I get done with going over this past year's legislation that passed, is rolling into an introduction of the Alcohol and Tobacco Commission, which will be an overview of how it operates, and then introduce you to a few key members of that as well, and let them talk a little bit about what they do. what they're saying for the future, and really give you a sense of where we're heading. So bearing with me, and this is my shortcoming, many of them. One of them is technology. So I'm going to try to share a screen and just run through a few PowerPoint text for you. Stand by. I think I've done this properly. And if anyone can go on and tell me that I have, just so I know I hit the mark, that'd be great. Is this sharing?
It's not sharing right now, Jeff.
It's not. Appreciate that. Let me. Okay, probably because I have to do that. Is that better?
Yep, you got it.
Thank you. Yeah, I did give the qualification that this isn't my thing. Okay, bear with me for just a moment. Okay, and I'm going to see if I can start the slideshow. If I can do that, and it'll be even better for us. Yeah. Okay, great. Okay, so the first I'm going to go over are statewide alcoholic beverages, and Ravi went over this too, so I don't have to spend a whole lot of time on this first one. But Senate Bill 205, House Bill 12 was really, really big. Essentially what it did is it took many of the additional provisions and privileges that you guys enacted through the governor's executive order for your retailers. And it's continuing those on for a period of time. Everything that's in this bill, eventually it's going to sunset or end on June 30th, 2023. At least it happens if no other action is taken. But this gives the retailers a little bit more time to get back on their feet and continue operations. And it also gives us time, as Ramey mentioned, the Alcohol and Tobacco Commission and the Maryland Department of Health collectively have to collaborate on a report to the General Assembly by the end of December 2022, so they have a chance to consider if these changes were effective, if there are any side effects, good or bad, that came from it, if there's a need to continue it, or if there's a good reason to just let it end July 30th of that year, 2023. So what it does, continues the additional privileges. It allows you as the boards to adapt regulations and set limits. And this goes back to what I was saying is you're no longer now just simply looking at the law and interpreting it and applying it. You're now being asked to evaluate how it should work in your jurisdictions, which I like that you have that authority. I like that you have that ability to help where you can help, to pull back a little bit where you need to pull back. You're going to be able to do that. It takes a little getting used to. You've done a great job this year. I like that you have that authority and ability this year. I'm here to help if I can in any way, as well as everyone from the ATC. You can set limits on the quantities of delivery for off-site consumption by your retailers, your packaged goods stores, your Class B's, restaurants, etc. The next bill, manufacturers license off-site permits. This bill does a lot as well, but thinking of it this way, if the first bill did a lot for the retailers and what could happen for them or did happen for them during the COVID pandemic, this bill does it for the manufacturers. It extends the privileges that the manufacturers had as well. An interesting element of this, and I'm not sure just why it's there, but it's interesting. It allows the Alcohol and Tobacco Commission to set fees for different licenses and permits that it issues. It sets a maximum fee of the amount that was currently enacted in legislation. So it doesn't let them go higher than what they could charge before, but it lets them set it so it could allow them to go lower. And that's going to be interesting to see how that plays out. It cleans up a few errors that existed for, say, microbreweries, and in some instances for the distribution of product to consumers from distillers and from farm brewers. In the case of microbreweries, many of their barrel limitations had been increased, and it didn't, because of COVID, the ability to pass some of this in 2 years ago shut down quite early, and they didn't get to pass some of the things everybody had agreed to, and an error was kind of left off. This bill went to correct some of that as well. I mentioned that they're able to continue their additional privileges. Another interesting thing is all of these different off-site permits that we have and that you all love / hate so much because you're not always aware of them. It's consolidating them all amongst the manufacturing types. So each manufacturing type had basically a similar off-site permit, but it was a little different in the number that they could have each year, in the amounts that could be sold or what they could do during each one. All of that's been consolidated. All of the number of off-site permits can happen like up to 32 times now a year, where it varied depending on the manufacturer previously. And this will allow them to continue in general to sell and distribute or deliver to consumers. This has a sunset of December 31st, 2022. So that's interesting. The sunset on this, no report required on our end, I don't believe, and the sunset on this is right before the General Assembly has an opportunity to meet for the 2023 session. So they're going to have basically an extra year and a half of being able to see if this works. And the intent mostly is to just help them get back up and running. So there's going to be this period of time from December 31, 2022 through the next General Assembly session to see if they decide to reinitiate. These two I'll be able to go through rather quickly. Industry practice prohibition. For some reason, some retailers, some of your retailers, your licensees for on-premise consumption were requiring consumers to purchase more than one drink at a time. I've heard a variety of different reasons, including that they are maybe just trying to generate sales by saying you've got to buy 2 or 3 instead of just 1. General Assembly did not like that, and they overwhelmingly passed this bill to ban the requirement that you purchase more than 1 drink for on-premise consumption. And the Alcohol Tobacco Commission, quite frankly and selfishly, this bill fixed a problem that was created in the previous bills that created the Alcohol Tobacco Commission. And largely what that was is I'm reading the law, and as Kathy mentioned, I'm still with the Field Enforcement Bureau of the Comptroller's Office, not with the ATC. And it's because as I read the law, I got an appointment letter from the governor saying, congratulations, and we're happy to appoint you. But the law said, essentially, I'm out of my pension. Now, I've been in this job for almost 19 years, and the law, as it was written, would take me out of the pension that I was in. So I couldn't accept the position. And fortunately, and thankfully, the General Assembly did introduce legislation this year, both of these bills, and they passed, and essentially just corrects it so that at some point, should the governor decide that I should continue or move into the ATC, I will. My pension remains intact. So it's a very personal bill, but I just didn't want to look like I was ducking it either. So you have a sense of what it's about. Now I'm going to go through the local bills very quickly by jurisdiction. Happy to take questions later. Again, I'm not sure if this presentation even is the time to do it or if it's something we do another day, but you'll see the bill numbers are cited here so you and your jurisdictions can go back and look at the specific bills. For Allegheny County, this establishes a BD wine liquor, a beer, wine, and liquor license. They can issue up to 2 a year. It's some kind of specialized license. And there is a food to alcohol ratio that's required. They have to report in. This next one I love, the gift basket permit. Every year from a couple of different gift basket companies. I'm going to explain this because it appears in a couple of different jurisdictions. The gift baskets are the gift basket companies wanted to include a bottle of wine or a beer or some kind of spirit or something with their baskets, but not prohibited. As you know, in Maryland, it's not allowed. Specifically, this gift basket will allow up to essentially a 6-pack of beer or 3 bottles of wine at a 750 size bottle, or even 3 bottles, 750 size of spirits to be included in a gift basket. The permit costs $100 a year. It's something you issue. It's good in this case for Allegheny companies to deliver in Allegheny County. And the same bill, the identical bill, quite frankly, does the same thing in Garrett County. It's $100 a year. The applicant or permit holder may not have any other type of alcohol permit, and no more than 10% of their annual gross receipts can come from the sale of alcohol. It's largely got to be gift basket costs. And annual fees, I'm just going to gloss over this as well because many jurisdictions are going through this year, which is its own issue. But the annual fees are either in every jurisdiction, in many jurisdictions rather, but each one we mentioned today, they're either waived or they're being refunded from last year, or late fees are not being assessed, or there's a reduction in the cost of the fees. There's a whole lot of different parts of this. I know you're going to have great interest in it. You will need to read these because you're going to be implementing it. So you'll need to read these in detail for those jurisdictions that have some sort of annual fee language. Anne Arundel County, they created a movie theater license for beer and wine. So that's on its own. They also have the annual fee issue that's being refunded. In this case, what's happening is any money they didn't spend on their operations this year, the balance of that has to be sent back to refund the license holder. However, there's not going to be enough. So they have to do it in a prorated portion. So they send back proportionally the right amount. And then next year, any amount of money that they earn in excess of their expenses will also go back to continue to refund. So it's kind of an interesting thing. Alcoholic beverage inspector simply takes a part-time chief inspector and removes that position from law and replaces it with the requirement of having a full-time chief inspector. In Baltimore City, BD7 license is it's just interesting. It's one of these ones that we see sometimes in Montgomery County as well. It specifies a certain block, the 4800 block of Hartford can have a BD7 license, and the certain hours are limited. And the next bill, House Bill 1288, that limits hours of operation in the 40th district from 10 a.m. to 10 p.m. Let's see, Senate Bill 426. It allows a Class 9 distiller, which is a limited distillery, who may have a Class 9 D license, a 6-day license, to convert it to a 7-day license. And it also creates some kind of a memorandum of understanding in the Brewer Hills neighborhood that will allow a certain Class D licensees to sell beer and wine. So I don't really understand all these necessarily. I know there's a reason for it that makes sense in these local jurisdictions, but just to give you a sense that it's out there and to alert Baltimore City to check it out if they haven't already. And lastly, for Baltimore City, Senate Bill 472, it just identifies how boundaries and borders are going to be defined. In Baltimore County, Senate Bill 424, just it's creating and then allowing to be issued a drugstore beer, wine, liquor license. And the second part, Senate Bill 38, Board of License Commissioners, it requires that the commissioners be a resident of the county and a voter in the county as well. Calvert County had one bill this year, and that's the annual bill. The annual fee bill that is either reducing or returning or refunding the bill. Please, Charles County, pay attention to this. Calvert County, Charles County. You have one Senate Bill 833 that passed, and this is interesting because it starts to blend. It starts to allow what is ordinarily a prohibition from a manufacturer to have a retailer's license, perhaps separate from that operation. In this case, to allow the manufacturer to have a retail license, and specifically, in this case, it's a winery, I believe, that is going to have a retail license operation. There's a variety of fees for that. Some of this are as a result of legislation passed a few years ago that requires limited wineries now to be using at least 51% Maryland juice in their wines, which is coming up, I say now, but it's actually coming up soon. Or to have 20 acres of vineyards under operation, under growing. And if you don't have that, you can't be a Class 4 limited winery license. So some local jurisdictions are looking at ways to helping those wineries exist. And I think this is important for that situation. Okay. Yep. That. Frederick County. Okay. Quite a few things happening here, but again, not huge. The barbershop thing, it just allows them to go from 5 ounces of beer to 12 ounces of beer that they're allowed to serve on their barbershop and beauty salon beer and wine license. So it only affects beer, 5 ounces to 12 ounces. The consumption permits. It is creating a consumption permit, what appears to be an on-site consumption or on-premise consumption permit for Class A location. The stadium license, it's banning the use of styrofoam cups at the stadium. And the wine definition, it's taking wine, which is defined in many different ways by percentage of alcohol, from as low as 14.5 up to 21% currently, and making it all at 22%. So it's redefining wine to allow for up to 22% alcohol. Okay, Garrett County. Bear with me for just a second. I think it's just starting to remove certain issuing. This act removes certain fees that the board was charging to issue types of Class C licenses and other license fees. It's removing that ability and allowing a Class C license to buy beer and wine and liquor. And they also have the gift basket permit. It's the identical one to Allegheny County. Howard County, the assisted living license program, it simply creates that license and it allows it to be issued to the manager of such a facility to serve its residents. Gift basket also in Harford County, again, it's a little different than Allegheny and Garrett, but not much. And it does have to be used within the county only. And again, it does serve to address an issue that has been recurring for us for many years in the comptroller's office there. Howard County, the first one just changes the number of Class A licenses that can be issued per residency. So it's the quota, it changes the previous quota. For the Class B, it allows for the second one, the Class B beer, wine, liquor license allows for the sealed container, sales of product in sealed containers for off-site consumption from a restaurant. Retail delivery, 1155, House Bill 1155, it just now allows by law the delivery of product to consumers, and it spells out the requirements for that. And alcoholic beverage inspectors, many of you know, or maybe you don't know, that in Howard County, the alcoholic beverage program is enforced by the police department. Mark Baxter has been the officer, and previously Marty Johnson before him, just so you'll recognize some of these names. They're the ones who had to do it and had the burden of doing most of the inspection and work on their own. This now would require the Howard County Police Department employees, inspectors to assist. Montgomery County just has a couple of bills this year, and usually there's quite a few, but they've only had a couple that they moved forward this year. The first one is it just gets it repeals a capacity. This is House Bill 430. It repeals a capacity requirement for public arts facilities. Simply enough. House Bill 432 allows for draft beers to be filled, be using growlers or refillable containers in Damascus. Previously had been banned, and this is what Kathy was talking about earlier, and I was in Baltimore City. Different neighborhoods want things different ways. That's kind of the beauty, difficulty in regulating, but the beauty in our system. And in this case, Damascus has now desired to have refillable containers. And also Montgomery County is another one of these counties that has some change in the annual fees during this period of COVID, how they're either going to refund or they're going to charge less or they're not going to charge at all. And they're going to not require that there be any late fees if there is some penalty otherwise. Prince George's County, Senate Bill 739, particular place in College Park that has a license will be allowed to have entertainment as well when the attendees are 21 years old or older. And they are for Sunday sales. Many areas aren't allowed to have Sunday sales in Prince George's County. However, in some of these areas, a Class A or Class B who's willing to put in $50,000 or more of renovation into their building may be allowed to get a Sunday sales permit in addition to the traditional. Queen Anne's County, Senate Bill 855 just simply removes the 500-foot distance requirement for places of worship. So it was before where you had to have 500 feet from a place of worship and a liquor establishment, no longer required. And the unannounced inspection, Senate Bill 854. Apparently, Queen Anne's County required that all of their licensees be inspected unannounced once every 60 days. This bill, which passed, increases it from an unannounced visit to one unannounced visit every 180 days instead of every 60 days. St. Mary's County House Bill 529 just creates the ability for them to have an on-premise consumption permit for a distiller, which also allows that distiller to use a non-alcoholic mixer in preparing a sample or drink through their permit. And also St. Mary's County annual fees, again, some consideration of refund or relief or reimbursements. Washington County, special events. Now I mentioned earlier that special events for all of our entities now go up to 32 per year. But in Washington County, for certain wineries, they're increasing it from 32 special events per year to 60 special events per year. This bill sunsets June 30, 2023. Wycomico County, let's see. Oh yeah, okay, so a Class A license typically would run, in some areas, a Class A license would run from Monday to Saturday, and this is increasing it to be a 7-day license, allowing it to be open from Monday through Sunday. And for golf courses had to have some type of a food to alcohol ratio in order to keep their license. That has been removed. There's no longer a need for food to exceed the amount of alcohol sales. And I stopped scrolling. I apologize for that. I get ahead of myself with what I'm reading. And so all of this is on this deck. All of it's available for anybody. It's a place to look at your jurisdictions and to see what you need, really what you need to do moving forward. And now, if I may, for a fun part of this is getting to talk a little bit about the Alcohol and Tobacco Commission, and then introduce you to some terrific people. So in 2019, House Bill 1052 created the Alcohol and Tobacco Commission. It was a fairly large bill, and it did a lot of things. And I want to say that the goal in this transition, well, first I would say it was to have taken effect last year, but the bill, it was a big bill. It moved very quickly, and it was a big bill. There are a lot of parts to it, and it didn't quite work the way it was initially finalized. So in 2020, Senate Bill 911 was also created to clarify this law. And in doing so, it also pushed back the enactment from last July to January 1st this year. It gave another 6 months to kind of get things working. So this year, the January 1st is officially the Alcohol and Tobacco Commission came to be. And the transition took several weeks really to move things over, because it's not like you turn off the lights one day and you turn them on the next and everything's the same. So we've worked collaboratively, and I say we, I mean the Office of the Comptroller and the Office of the Executive Director, which is currently headed up by the Acting Executive Director, Tony Hatcher. We've worked collaboratively, and we established an MOU rather quickly to share certain responsibilities, to share resources so that we could make this transition happen. Because as I said, we couldn't stop one day and fully operate the next day, but by having this MOU in place, it allowed us to continue operating, and it's still in place till the end of this month, and I have every reason to believe it will be extended for at least another 6 months or a year, which is really kind of vital to the operation, because there are just certain functions and help, quite frankly, that the ATC needs, like human resources help and budget and finance help and IT help, that just isn't provided for anywhere else that the comptroller has and is allowing us use for. So anyway, MOU is created. It helps for a smooth transition. Our goal and intent and meaning for all of this is that you and consumers and the industry see this transition as a seamless transaction as much as we can. No, that's not always the case, but as much as we can, we're trying to make it seamless. So the ATC exists. It took the responsibilities for alcohol and tobacco regulation, not taxing, but regulation, and moved that to the Office of the Executive Director of the Commission from the Comptroller. I don't know what happened. And I'm not sure where I left off with you all. So I'm not sure what just happened, but I think I was just like on the introductory page of the ATC. If it's something other than that, please let me know. Otherwise, I'm going to try and start from there again. Well, this is unfortunate. Now, I'm not sure if I can. Is this me back now?
I'm controlling the slides, but you just let me know when you want me to go.
Okay, let's go ahead and advance from this slide. Thank you. Yeah, I don't know what happened here. Oh, go ahead and advance then if you would, please. Okay, so it's Alcohol and Tobacco Commission, and I know that tobacco isn't necessarily something that you're going to be hugely interested in, but it's important to understand what all the obligations and the responsibilities are of the ATC. So, and I'm going to go over these very briefly, but to say, in addition to alcohol, which we're going to continue to talk about in just a little bit, we're responsible for the enforcement of tobacco issues. There are 4 titles in Maryland law that deal with tobacco and that place the responsibility for enforcement on that on the ATC. The first is about cigarettes themselves, which are very narrowly defined items, which essentially, when you think of a cigarette, you know what it means in your mind. That's what a cigarette is, and we regulate that. Next slide, please. Another type of tobacco is a very general category, but this is a legal term in the law called other tobacco products. And essentially, other tobacco products always meant everything that's tobacco related, but is not a very narrowly defined cigarette. It's everything else. It's a cigar, it's snus, it's chewing, it's just about anything else you can think of with tobacco. And with rare exception, we've added to that, but that's pretty much what other tobacco is as well. Please advance. And now we come along with this thing a few years ago called electronic smoking devices, which the FDA has determined is in some way a tobacco product, but it's treated a little bit differently in Maryland. While it is a tobacco product, the others have excise taxes on them and are regulated a certain way. Electronic smoking devices, not quite the same, but it's a third element, it's a third type of tobacco that's regulated by the ATC. And next slide, please. This is going to take effect next July, not this July, but next July. The out-of-state sales of premium cigars and pipe tobacco, which is a huge business, which has been unregulated and has been really, the excise tax hasn't been funded or hasn't been paid at all. That all gets fixed in a year. That's another element that the ATC will be responsible for. Next slide, please. And this is just very, very quickly. The taxes they range widely from cigarettes. They went from $2 a pack just this past year, from $2 a pack to $3.75 per pack. Across the country, that's one of the higher rates. That's one of the highest rates across the country. And you think that Virginia is next to us. Virginia charges 30 cents a pack, excise tax. So you can imagine the smuggling that takes place, which is a large part of the work we've always done and will continue to do. Other tobacco products have gone from 30% of the wholesale cost to 53%, considering, again, our neighboring state, Pennsylvania, which is a big source for other tobacco products, charges 0% for their out-of-state shipments of other tobacco products. So we're paying 53%, but you can imagine it's coming into our stores from Pennsylvania. We do a lot of work there as well. And then the electronic smoking devices are going to be taxed as a sales tax, not an excise tax, at 12%. And the liquid that comes in the very small containers, think of like a replacement cartridge for an ESD device, not the raw liquid, the bottled liquid you buy, but the devices, the containers rather, 60% sales. Maybe please go on to the next one. Okay, and as we always do, and we'll continue to do, we're going to do the inspections of the alcohol locations like we always have. And we're going to report to you violations of retailers when we find them like we always have, and we'll be prepared to testify before your hearings. Now, typically, our seizures are for it being a contraband product, which means didn't come in the state the right way and no taxes have been paid on it, or it's in the possession of a retailer, but it got in that possession of a retailer through an illegal or against regulation manner, like other than a wholesaler, like a retailer going next door to a packaged goods store and buying product to put in their own operation for a busy weekend. All of that gets seized by us. Continue. Okay, well, there you go. That's kind of what I just said. But this is if the tax isn't paid on it, it's contraband, we take it. If the paperwork isn't there, if you don't have the receipts, if you don't have the invoices, we take it. Next, please. And we have, if any of you are familiar with the Treasury building, if you are, it's a decent sized building. Think of the footprint that it makes. Virtually the front half of that building in the basement are our storage vaults. We try to keep them neat, but they are jam-packed full of alcohol and tobacco, contraband, and evidence. Contraband, we keep for a period of time, and largely, once the case is completely disposed of, or there's nobody tries to have a hearing to get it back, then we destroy it. In the case of evidence, we hold on to it until the case is adjudicated. After it's adjudicated, it's destroyed. If it's not, we hold on to it. Next slide, please. And within the Alcohol and Tobacco Commission, several members are deemed hearing officers. They conduct hearings for alcohol seizures when someone wishes to get that back, or tobacco seizures. And they also conduct hearings when a retailer of tobacco products makes a sale to an underage consumer. Many local jurisdictions' health departments will send underage consumers out and will attempt to make a purchase of cigarettes. And when they're successful and they adjudicate it locally, there's another violation after that happens. They send it to us, and we actually act against the license itself, not against the person who sold it, but against the license to operate. We look into this to see if it's being used fraudulently. And if it is, we can issue a warning, we can suspend the license, we can revoke the license. And whenever a license suspension or revocation takes place, we always send agents out to inspect, to re-inspect, to make certain we're not making sales of it. Next slide, please. And just very quickly, a whole lot of things can happen as a result of these hearings. You can be suspended for a period of time, you can be revoked, you can get some sort of just a warning perhaps. If you're being suspended for a period of time, you may, as a license holder, you may ask the executive director if you can offer some amount of money to not suffer the period of time for the suspension. The executive director can decide to do it or not. The only reason an executive director would do it is if the quantity, the amount of money is sufficient enough, quite honestly, to make a point, to decrease the likelihood that this violation would be repeated. If it doesn't meet that, then the executive director is probably not going to accept it and make the entity, the licensee, go through a very expensive period of suspension. Next, please. We'll just pass that. We just kind of talked about it. Okay, so now this is the fun part, the actual fun part. So Bill and Jack and Andrew, please turn on your microphones and unmute yourselves and turn on your cameras. I'm going to introduce you to a few members. I don't want to share screen anymore. I just want to go right to these guys if we can. I see Andrew, I see Jack, and then Bill. Now we have a whole lot of stars in the ATC, and I'm really proud of this crew, just across the board. I'm really proud of them. I've always said I have one of the best jobs in the state, and I do, and I expect that if I have the opportunity to go to the ATC, that it's going to be even better still. To be reconnected with this team that was hard for me to let them go to the ATC, but they're a great group of people. Very quickly, I'll introduce them, and then I just want to engage in a little conversation with them and let them tell you about what they do and what's working, what's not, what challenges, what to expect in the future. So the first person I'll introduce to you is William George, Bill. Bill George has been a police officer for 20 years with Anne Arundel County, retired from there and came to the comptroller's office, where I'm sure 40 years ago or 41 years ago, he never thought he'd be getting another job that he would spend more time at than Anne Arundel County. But here he is. When he was in the county, he had a whole bunch of jobs. He's got a varied career, and maybe some of the more interesting stuff was working as a narcotics officer in a wide variety of doing it with federal agencies, doing things locally, and something that really he didn't know at the time was laying great groundwork for what we do a lot of is interdiction work. He did a lot of drug interdiction work, which is what we do now massively relative to alcohol, and even more so with a variety of tobacco products in the state. That's Bill. Jack Hartzell is also from Anne Arundel County Police, retired after 29 years there. And I've known these guys, we've known each other for most of our careers. So we're experienced, maybe is what I would say. Not old. I've known Jack for a long time as well. Jack he's been in the military, served in the military. He went to college. He came to the Anne Arundel County Police Department and spent 29 years and was all over the place. He retired as a sergeant. He was in charge of a patrol squad. He was involved in criminal investigation division and played a huge role there. He was in the homicide unit, and you can just imagine how difficult that is. He was in like the sex crimes unit, quite frankly, which is also another difficult area, and maybe even at least equally in so many ways, elder abuse and child abuse units, which really tough to see what people can do to each other. And Jack somehow managed to not just do it, but knew he had to be the guy there at the time to do it. And he continues now as the division administrator for the field enforcement. And Andrew Waters, wow. Andrew came to us a few years ago, a graduate from Salisbury University. And when he first started working, he was working in the front office because his education was in political science and history. And he was in the front office for a bit, and an opportunity came. Once somebody in the front office said, "Hey, we've got this guy, we're underutilizing. Do you think he can help?" And I'm thinking, I don't know how much help he can be really, but what's this going to cost me? Do I have to give you a pin, position to get him and whatnot? I said, no, we've got him, and he might be good for you. So why don't you see what you think? So we try him. Man, he's scary. He's not good. He's great. And he's heard me say this numerous times. If I'm here long enough, I'm going to be working for him someday. And somehow you all are going to be hearing from him for years. He's spectacular. He's sharp. He's fast. He's can do on everything. If there's a task that he doesn't want to do, I've never seen it. You can't ask him to do anything that he doesn't say can do with a smile and get it done quickly. So these are people I'm just thrilled to work with, if you can't tell. And these are just, honestly, just 3 people who are available to be here today. We got a whole host. So all of that to start off with. Bill, would you please take some time, tell us about what you do for the commission now, what your role is, and we'll just kind of engage in a conversation.
Thank you very much, Jeff. I appreciate that introduction, and good morning to everyone attending. Right now, my position is the agent in charge of the Field Operations Bureau for the Alcohol and Tobacco Commission. Formerly, I had been the agent in charge of the Enforcement Bureau within field enforcement. In large part, my job has stayed much the same. I pretty much oversee the entire inspection and enforcement programs. I work with the supervisors and the inspector in charge, who's no longer a member of, or he's not a member of the ATCs, he's within the comptroller's office, just to assure that our inspections are occurring evenly throughout the state, and the data is being recorded properly, and the enforcement is handled appropriately and evenly throughout the state. One of the biggest challenges with this transition, and it's a challenge, but a challenge to me is excitement. Change is excitement, and I'm blessed to be a co-worker with Jeff, who is a friend, and these 2 gentlemen here, on the screen, both Andrew and Jack, and others who aren't here today, that are all of that mindset. This is a big change. This is huge, and we are part of the development of a brand new state agency that is super important. I see it as an opportunity. I see it as an opportunity for personal growth and an opportunity to provide a higher level of service to the taxpayers in the state, to the businesses in the state, and to each of you out there in these local boards. I have somewhat of a vision of how I want to approach both the communication with each of you and how I want to administer our inspection and enforcement programs as time goes on and things evolve. One of the biggest challenges for me right now is the staffing, and that staffing, we've worked on it pretty extensively in creating a very solid organizational work chart with bureaus, sections, and units to address the specific requirements that the law installed into House Bill 1052, and in doing so, we had to sacrifice. We had to sort of sacrifice in other areas where we didn't have mandates. We have these new obligations of training, these studies, and these reports. So we had to dedicate personnel in those positions as we built out our work chart. And for me, the biggest challenge is, prior to the creation of the new agency in the beginning of this year, I had a group of inspectors and agents that were working in the field. If fully staffed, it was 23 of them who would conduct these, on-site inspections, routine random inspections, both for the alcohol and tobacco and motor fuel also. Right now, the Alcohol and Tobacco Commission has 8 agents that within the staffing that will be doing the inspections. Now, like Jeff had mentioned, we have an extremely strong alliance with the comptroller and a very, a very friendly memorandum of understanding that allows for the sharing of authority and jurisdiction and personnel and resources that does give me a tremendous amount of flexibility to work with the comptroller's office, the management team there, to use those folks to accomplish our goals, that are set out by the Alcohol and Tobacco Commission, while at the same time we are helping the agents and inspectors at the comptroller's office accomplish their goals through our inspection process. It's an exciting time. It's a challenging time, and I couldn't be more proud of how things have progressed. And I see it as an incredible opportunity to improve the level of service that we're going to be able to give to the business community, the taxpayers, and the local boards. The communication going forward between our office and the local boards, I see exploding.
How so, Bill? How so?
Well, through a very routine, regular, open line of communication that we're going to establish with each of the boards, and also provide information through our website that will be accessible. Now, when I say advisories, I expect us to be posting advisories that would go out to you, to each of the boards, that would highlight our activity as far as what we are discovering in our inspection processes that lead to enforcement and in discovering violations. Our particular instances, of those examples, along with the types of violations and the sort of the red flags that we came upon, the trends that we're seeing out in the different areas throughout the state. And also we communicate with other agencies outside of the state, any other trends. Just being able to provide you with that information, I think gives your inspectors, it will give them a leg up on what to look for when they're doing their inspections. And hopefully the communication will go both ways, because we certainly can learn from everything that you and your folks are doing out in the field. But I see us working as a close partnership, going forward, way beyond what it's ever been.
Well, and that's interesting, Bill. Let me just address one issue. You mentioned staffing. So, working for any government, we always have to say that we're staffed exactly as much as we need to be. Now, having said that, the reality is they sent over positions that had to be sent over. It's difficult to know how many we need in the beginning and how many would need to remain behind. And what Bill and I and a couple of others did, Tony for sure, did was really dissect what the mandate of the ATC was. And there isn't any statement in there that says they're going to conduct so many inspections every year of anybody. It doesn't say that, but it does say that we're going to provide training across the state, uniform training to different inspectors and jurisdictions, that we are going to offer advice on budgetary help for the local boards, that we're going to provide public health and education, and we're going to look at labels. Now we're going to look at labels. It says we are going to do all of those. So we had to reallocate positions or vacancies that we would have perhaps staffed with inspectors, and we put them in agents. We put them in non-agent, non-enforcement roles. Many are still vacancies that we're going to be fleshing out, because it's, we don't have a lot of wiggle room, so we need to get the right person for the right job. But we'll be fleshing those out with the hope of spending time in the next couple of years of then also building out again our agent staff, our enforcement staff. Having said that, Bill, good news is this. Recently, I've been talking with Department of Budget Management and the budget analyst, and they've asked for, I thought they were just asking for us to give an FY23 budget projection, but instead they were asking for FY22, which takes place in July, and said, what do you need now? So we ask for what we need, and we try to put together a realistic package of what we need, which includes staffing for agents. So I don't know if we get that or not. I say this to everybody, I'm hoping we do. In any event, something we've talked about for years is local inspectors and state agents working together, doing inspections, being force multipliers. We want to continue to do that. Andrew, you've seen how well I work technology. Would you be so kind, if you can, to post in the chat so everybody can download a copy, a listing of our agents and the jurisdictions they work in with contact information, so that everybody will have that. You may already know these people, but nonetheless, get familiar, make that call, and make the connections Bill was talking about. Thank you, Bill, for that. I appreciate it. And
Thank you.
We'll come back with a couple more questions. I want to get Jack in on this. Jack is really, if you will, a jack of all trades. He is currently has been. He does a lot of different things for us. He has for years. And he continues to do these in the guise of the ATC, but now even more so. Jack right now is going to be in charge of commanding the unit of bear with me for a second. We have a name we think we like for this. It's the Education, Public Health, and Facility section. So it's a big basket. But Jack has already done training is not part of it. He's been doing training of a variety of types for years. And since he's been in this position as division administrator, he is our chief trainer, at least training coordinator. And so he's going to continue that role where he'll be providing training internally, but also looking for opportunities and ways to train the inspectors across the state in a uniform manner as well, and to, in a way that's very helpful and informative, educate the public. We want our website ultimately to be a great resource, like a library type resource for the public, for the industry, for you guys to use. So Jack, can you tell us a little bit about your new role and training and some ideas or thoughts you might have, or even really what's required of you?
As it stands right now, I am in the process of getting our agency coordinated with the state in reference to all the forms and things that we have to do to make us a police agency, getting us up with CJIS and like an ORI and all that type of thing. But on top of that, I'm also the training coordinator, and part of my job is to develop our annual in-service training that we have, which facilitates between firearms and also in classroom training. It's broken down. There are mandates. Since we are a police agency, there's mandates that we have to meet every year, but also throughout the year, we also have to try to figure out different things, alcohol, tobacco related, and formerly motor fuel related, that educate the officers when they go through their in-service training. Now, expanding on that, what we could do throughout the year is to assist the counties. We do an FTO program when we come through with our new agents and inspectors. They go through a lengthy period of time where they're out with an experienced agent and an inspector, learning the job out on the road. Now we can offer, not only to that, but maybe a new inspector with the county, if they would like to ride with one of our guys to see how we do our job. And, it might give them a better insight of what we do and give them an idea of, some ideas that they hadn't seen or seen before. And also on the flip side, give our agents an idea of what they do, what they go through all the time. As far as planning for the future for training, there's all sorts of things that we can do. Like we were discussing, maybe video trainings that we can put out, or periodic updates that we send out to the counties and give them an idea of trends that we're seeing. We also want to solicit from the counties things that they're seeing so that we can get it out to everybody. Other types of training could be maybe like a regional training, like if we have some agents that are experienced in a certain area and say, hey, they're seeing this out here. Let's take it over here, and maybe we can expand on it over here. You get something maybe like on the Eastern Shore, they have stills, and the guys up in out west, they may have them, but not the knowledge to look for the type of things that they're seeing over here on the Eastern Shore or something like that. Maybe give them a little education on that so that they can see that coming. Let's see, one other thing I wanted to say was, gotta put my eyeballs in. Most of it it's an evolving thing because it's brand new. I mean, as it stands right now, we're holding, in my position right now, I'm holding the position as division administrator for both agencies right now until we can get somebody up on the other side. So it's a very large task right now, but we're managing well. And like I said, and you've said before, we have an MOU that we work great together with the comptroller's office so that we can continue the job. It's a very seamless thing. Nobody's noticed the change yet. They know that they're getting to know that the ATC is out there, but they don't see a difference in our work process.
That's important. Thanks, Jack. That's really important. And I know you said something about regional training. We've done training in the past where it would be, we didn't do it last year, but we did the year before, where we invite all of the jurisdictions into generally Annapolis, and we hold a
Exactly.
massive training program, which is great. And I'd like to still do that, but I'd like to explore. And I know we talked about, you mentioned regional training, where we kind of can a certain type of training and then maybe hold it regionally in 4 or 5 locations around the state. And maybe it's by the instructor, maybe the instructor is the agent who works in that area that might be
Exactly.
able to provide the training. So it furthers that relationship, but it also gives some uniform tips along the way. As I love some of the stuff we're able to teach, and it would be nice if we can do it statewide. And, we've had to use virtual training, virtual meetings, which wouldn't necessarily be thought of as the most ideal, but to get along quick tips and training, this actually may not be a bad thing to do. This organization meets pretty much weekly right now. And if you make it every week, great. If you can't, there's another one coming next week. And so it's a nice way to go. And I appreciate that, Jack. Thank you very much for that. And I know it's a daunting task. One of the other things, again, that everybody else, the idea of moving, you can't. I don't want to underscore just how disruptive and difficult this was, just emotionally from everybody. We've all worked together for a long time, and people are now in different agencies. Now we're physically in the same place for the time being, but they're different agencies. But the mindset, while a lot of that was difficult to go through, the mindset of these people, when people outside of the office or outside of our agency said, how in the world did you pick who goes where? And we did it by specialties and geography and needs and that kind of a thing. They said, well, didn't people complain? Weren't they concerned or upset? And you know what? They weren't. Now, I know it's disruptive. I know all that. But this is a group of can-do people who you just tell them what the mission is and they get out of their way. And they did it. That's part of what's happened here. And just before Andrew comes on to talk about some areas, because he's got one of the bigger jobs, I think, and that is coordinating. We're going to call them the regulatory and research section. The regulatory side is its own thing that we've been doing, and it's actually he's very fortunate. It's staffed by experienced, great, capable people who are going to just keep on doing what they do, and that's going to be Class A service still, just going to continue to be. And then he's got to now start to spend a lot of time thinking about research. Now, Andrew's always been our go-to guy for research and for reports. He's always been the guy. Now he's going to have a bigger job because there's a bigger requirement. And now it's not just internal researching that we might ask him to do, but it's researching for you. It's researching for the General Assembly, for the governor. It's a very big task. So before he tells you about that, I would just caution everybody, if you're at work one day and you see Andrew walk past you into the boss's office, he might become your boss. So be sharp that day, sit up straight. Andrew, can you tell us about what's going on with your position?
Thank you, Jeff. I appreciate all of the kind words. So my role mainly focuses around what we've always been doing, getting our licenses and permits reviewed, issued, out on time as quickly as we can. It also includes a lot of meeting these new requirements that House Bill 1052 has established. That includes conducting studies, compiling new reports, developing best practices for various activities, which includes a lot of new reports that, frankly, we would like a little more clarification on. There are a lot of things that we track, but when it comes to reporting to the local licensing board when we issue a license or permit, 10 days within receiving an application. Logistically, we make every effort to adhere to the law, and we will continue to, but it can be difficult to get within that timetable of receiving the application. Ideally, from our point of view, reporting within 10 days of issuing the application would be a little more conducive. We have a handful, less than a handful of employees that focus on all of the state alcohol and tobacco licenses and permits, and they work incredibly hard. But it is a tall task. And in fact, if anyone is interested in coming through the Annapolis office and visiting our licensing team, we had a few commissioners come by. Jeff, I believe that was a few weeks ago.
Yep. Yeah. Actually, that's a great idea. You should probably schedule an appointment, because if there's interest, and you guys happen to be in Annapolis, love to show you the property rooms, because it's just kind of interesting to see. It's kind of a neat. And then to take you back to show you where licensing takes place and how much activity there is. The idea of making a notification within 10 days of receiving an application is a tall order, but it's the law. We're going to try and do it. It's a tall order though, and I'm not sure what that benefits anybody, because I think the benefit would be receiving notification of the issuance of something. But nonetheless, it's a tall order, and we're going to try. We're going to try. But you should come up and take a look at this area, because it's not a huge area. It is jam-packed with documentation. You know, we push through this unit between the variety of different permits and cards and licenses and things. There are tens of thousands of pieces of paper of process applications and things that go out every year. It's amazing. It's going to get better for us. The comptroller's new Compass system, which is comprised of tax processing and this reporting, the licensing stuff. It's going to be a big help, only to the extent that we can keep access to it. And that's part of our MOU, is letting us keep access to that, because what that does, and what some of our license and permit holders this year have experienced, and Andrew is an absolute whiz at this. He's navigated this whole thing through for us this past year. A licensee or permit holder during renewal time is going to get a coupon from us. Previously, they have to go online, scan or print off of online the renewal application, fill it all out with all the details, mail it in with their check. It gets put in a pile and processed as we can do it. Now, they're going to get a coupon mailed to them in advance of their license or permit expiring. The coupon is going to say, this is what we know to be true about you as of last year. It's going to have all the most current information on it that we know to be true. They're going to review that. If it's accurate, they're going to check off to say it's accurate. They're going to sign their name attesting to it's being accurate, and then to all of the obligations they have, like letting us come in and inspect at any time. And then they're going to send in a check. They're going to mail them both in, and then the system takes the check and it takes this coupon, it marries it together and says they're ready to go. And then the licensing unit just has to print out all the new permits and licenses, and then which goes to the mailroom and is automatically mailed out at that point. It will help so much. What I hope we can do, and Andrew, we talked about this some, what I hope we could do is somehow incorporate this notification of local boards. I love the idea of being able to do it. It's a matter of physically being able to do it. If we can somehow get that programmed in, so that when the license is, I honestly, we have to get the law changed, because I think issued is better than applied for. But once it's, let's say, issued, then they get an email notice. The email of record gets an email notice from us saying, hey, we just issued something in your jurisdiction. And is that feasible?
So we have, gone live with this system almost, it's been about a year at this point. As you can imagine, integrating a new tax system combined with COVID, it was a less than ideal start to it, but we have been, working through it, and having some type of notification when we issue those licenses, I think is something that we can do. It'll take some work. We're still working out a few kinks, but all in all, the system will do what we want it to do, and that's all we can hope for. On top of, continuing to issue our licenses, we're also going to start creating new sort of statements about the public health impact that comes with changing changing laws. As you know, as you mentioned in your opening segment, a lot of laws change every year. So we're going to try to keep up with that and see how that affects different jurisdictions. And there's a big emphasis on the alcohol awareness program, making sure that every license is following the rules, making sure that at least one person is certified when beverages are being sold. A lot of emphasis is put on public health, and that's something that we're going to keep enforcing.
Yeah, that's really a front and center issue for us. And I appreciate you bringing that up. And one of the requirements is that we weigh in on any legislation concerning alcohol or tobacco, weigh in with public health concerns, which is not as easy to do as it is to say, because we're not, generally speaking, public health experts. But I'm sure we'll be able to lean on Department of Health to some extent, and maybe we will be able to find that right person. So there's that opportunity. And thank you, Ramey. I see what you're saying. Thank you very much for that. And also, Barb, I saw your question about marijuana. If it becomes authorized for adult use as opposed to the medical marijuana, don't know if it's going to happen. It might, but there's talk that it will. It's hard to imagine. 5 years ago when they started talking about it, I thought it was nuts. And every year it's closer and closer to being real. And so it could happen. And there's a lot of indications that could go to the ATC if that were to happen. And so it's in the back of our mind constantly. We have forged relationships with states that have this already enacted. So they have policies and regulations and laws in place that we get along with very well. And I know they're going to help us. We'll share information. So we think about it. We're pre-planning for it. Don't know if it's going to be next year, but it might be. But that'll be a big job also. We have to be careful to not let it sidetrack us from our main obligation here, which is regulating really in every sense, every element of alcohol and tobacco. Okay, so if you'll bear, I said I'd manage the clock. We have 10 minutes to go. Let me first ask Andrew or Jack or Bill, do you guys have anything else you'd like to say or add? Anything you'd like to, we have 10 minutes. I still want to allow time if anybody has questions beyond what I just mentioned, but is there anything else?
I was asked by one of the panelists that what our training priorities would be. And initially, I mean, since we are in our infancy, we're still establishing what the priorities are going to be, but our main priority is definitely inclusion of everybody in the state. We want to, make sure that everybody's on the same page working together.
Yeah, and that's going to be a work in progress. And we had talked about using a wide variety of things, as both Bill and Jack mentioned. We want to make great use of this website. Now we don't. We're just coming out of our shell. We're just coming out of all of this. The website we use it's housed on the comptroller's site for now. Some of that may have to happen as a result of necessity, because in our MOU, in keeping contact with the tax and licensing computerized system, we are going to be bound to certain IRS regulations, which might mean that we have to live for a while in the comptroller's office, or we have to, and I do not want to do this, we have to go back to a time where we issue licenses based on Excel spreadsheets, and that was our database, and that's how we kept it up. We don't want to do that again, not ever. It's the human resource need is astronomical. The room for error is huge. The frustration of the public, of the applicants, is huge. We don't want to lose that. But in staying with this system for now, and it's a wonderful system, it requires us to be linked into the comptroller for protective reasons, really, for data protection. So I may mention that, but the training, we want this website when we can. We want it to be a place where you go to and get all sorts of information. Maybe it's going to be AG opinions. It's going to be bulletins and administrative releases and things we put out. It's going to be, maybe at some point it can be, Kathy, what you started with SurveyMonkey. Maybe it can be frequently asked questions by agencies and by you guys. And when the answer is there, it's published so that everybody can see it. Maybe it's going to be. So we want it to be there. But thank you, Andrew. Jack, thank you. I appreciate that, sir.
Somebody asked what our website is.
Oh, okay. I'm not sure. And I'm going to say I'm not sure because we're trying to get it to be a .gov website. And to do that, you have to apply to some organization called gov.gov. We've done that months ago and haven't been given one. We hope it's going to be is mdatc.gov, mdatc.gov. There is a website now, but I'm not sure just what it is. And it looks like maybe Ramey's put something up out there. So there is something now, but we want it to be a very easy website name to find. So it'll be like mdatc.gov once we get the okay to do it. And are there any other? Yes. I'm just reviewing what I see. Oh, Brandon McFadden's out there. Hey, Brandon, good to hear from you. One of our colleagues. Okay, I don't think we have any other questions from anybody right now. If there aren't any, Bill and Jack and Andrew, thank you very much. Again, very proud of you guys, very proud of our organization. I hope you can tell that. I hope you can feel the excitement that we all have for this, because it's we see this as an opportunity to rekindle and reestablish relationships with our liquor board partners. And honestly, and as I mentioned, tobacco is the other half of what we do. We see it as an opportunity to initiate these same kind of relationships with the local authorities who are involved in tobacco control, and largely their departments of health locally. And we've always worked with a couple who are very strong, but we didn't work with many because they just weren't as engaged as others, or we just didn't ever make that connection. And we're going to reach out and make those connections now. So you know, the world's our oyster. This is a chance, and I think Bill said, a chance to do something brand new with a brand new agency. The possibilities are endless. The excitement is very high, and you know, we're good. So thanks, Kathy.
Thank you so much, Jeff. You guys are awesome. This is going to be a lot of fun. I think the word opportunity, there's my light again. The word opportunity is going to be an important word for all of us this year, especially in the next couple of months. This is an opportunity to start new things, maybe see what we've developed and what we've created over the last year and a half. That's going to kind of be a hybrid of what we did before. So it is an opportunity to move forward, build new relationships, rekindle old relationships, and just get stronger as a state. Our jurisdictions have really stepped up during this pandemic, and really excited to work with all of you and consider all of us a resource as well. So we'll do this together.
Put your seatbelts on. You better believe it. We're gonna start moving fast.
And they say we're antiquated and alcohol laws are all, you know, standing still. Nothing has stood still the last year and a half.
Nope, turn on its head.
And we've done a great job. So anyways, thank you all so much. Great presentation. Really stand by. I'm sure you're going to have more questions. You're always welcome to the Friday calls. We're going to continue those and keep these conversations going. So thank you so much for everything. And we're going to now take a break for all of those that want to go get something to eat or catch up on your emails. And we'll be back at 1 p.m. So thank you all so much. Take care.
Thanks, Kathy. Bye-bye.